This is a comprehensive overview of cancer. Cancer is the second leading cause of death worldwide, and in 2020, 10 million deaths were attributed to cancer per the American Cancer Society. So, what is cancer? Cancer is not a single illness, it's a collection of over hundreds of different diseases that all share a major factor, and that's uncontrolled cell growth. So, normally our cells will follow this pattern of growth, division, and then death. But it's a very organized pattern but not in cancer cells. Cancer cells ignore this rule and continue to divide even when our body doesn't need them. Over time, these cells can form a mass called a tumor. There are two types of tumors. A tumor can either be benign, meaning it is a non-cancerous mass, or it can be malignant, meaning that it is cancerous. Also, we see in cancer cells, they can stay in a localized place within the body, or they can spread to other parts of the body, and that's called metastasis, and it is one of the most dangerous aspects of cancer. This chart shows you some of the cancers that you can have. So you have meningioma, thyroid, breast, liver, gallbladder, stomach, pancreas, colon, ovaries, uterus, kidneys. You can have a melanoma, leukemia. There's a lot of different types of cancer and processes that are affected by this disease. So how does it start? Cancer begins when your DNA inside of a cell becomes changed. These changes are called mutations, and they can happen for a number of reasons. We see a small genetic factor in some cancer. You can inherit these gene changes, but mainly you see lifestyle factors like smoking, poor diet, alcohol use, and lack of exercise, or environmental exposures like radiation or harmful chemicals. Sometimes we can develop cancer due to infections like HPV or hepatitis B and C. When enough of our mutations build up, these normal cells can start to turn into cancer cells as well. This chart just shows a little bit about how normal cells look and then how cancerous cells look. So you see in the first box how that many of these cells are continuing to grow and divide. Um, and then you see this change in shape. And also we see this nucleus in this third box here being larger and darker than normal. You see an abnormal number of chromosomes, and then they cluster in these groups of cells without a boundary. So, what are the common signs and symptoms of cancer? Cancer can look different for everyone. It can look different depending on where it starts. It can look different depending on what type of cancer it is. Um, However, we do have some general symptoms and signs that can be warning signs. So some of these include unexplained weight loss, persistent fatigue, chronic headaches, chronic pain. We do look for lump or swelling in like your armpit or your breasts, changes in your moles, a long-lasting cough, hoarseness, or difficulty swallowing, bleeding or bruising unexpectedly. Having these symptoms does not always mean cancer, but they are signals that you should probably see a doctor and get it checked out just in case. This is just some more ways that can be early warning signs. So, how can we prevent and reduce our risk of cancer? Not all cancers are preventable, many are. Some of our most effective ways to lower your risk are avoiding tobacco or nicotine use. Tobacco is the biggest preventable cause of cancer, and it is also the most frequent cause of cancer. Things like eating a balanced diet with plenty of fruits and protein and vegetables, maintaining a healthy weight and staying active, limiting your alcohol intake, protecting your skin from sun damage, wear your sunscreen, getting recommended vaccines, or attending regular screenings like mammograms, pap smear tests, and colonoscopies can lower your early detection risk. Um, and it makes treatments more successful in the long run. Here's some more examples. So, how do we treat cancer? Cancer depends on the type and stage of your disease. Some of these common treatments are surgery, removing tumors from your body. A lot of the times, if a cancer metastasizes, there's better ways to treat than surgery. So that's when things like radiation therapy or chemotherapy and immunotherapy come in handy. Radiation therapy uses high energy rays to kill our cancer cells. Chemotherapy are drugs that travel throughout our body. Immunotherapy is going to help our immune system recognize and fight these cancer cells. Targeted therapy are drugs designed to attack specific genetic changes in our cancer cells, or hormone therapy, which are these like beta blockers that help certain cancers grow. I mean, it blocks the hormones that help certain cancers grow. We've had a lot of advances in medicine that have improved our survival rates and our quality of life for a lot of patients. Here's another example of some ways that you can treat cancer. So, cancer remains one of our greatest health challenges of our time, but it's also an area of rapid progress, innovation, and hope. By deepening our understanding of how it develops and spreads, we strengthen our ability to prevent it or detect it early and treat it more effectively. A lot of positive health decisions, avoiding tobacco, staying active, protecting your skin, receiving your vaccines, keeping up with your screenings can reduce risk and save lives. Early detection is not helpful. It's life-changing. It's the difference between beating cancer or not. So, scientific breakthroughs in immunotherapy, genetics, and precision medicine are transforming treatment possibilities and improving our survival rates. While cancer affects millions of people, the collective efforts of researchers, healthcare providers, communities continue to push us toward better outcomes. Cancer is a very powerful disease, but being knowledgeable and allowing prevention, early action, and advancing science are even more powerful than this disease. The more informed we become, the better equipped we are to protect ourselves and support our loved ones. And these are my references.